Hello everyone, I'm Dr. Satpal Shekhawat and I'm a GP at Curtin Lindsay and Scottish Surgery. I'm just going to use this short video to show how you can use templates in SystmOne and Ardens to help you with safe drug monitoring, identifying patients who require any blood tests or physical exams to allow for safe prescribing. So in order to do that, on the bottom left corner, if you just start typing drug, it will bring up this template which has a icon of a capsule. If you click on that, it will open up the drug review tab. Now I'm using a live patient here, so I can run. So as you see on this top button which says run safety check, if I click on that, it's going to run the pincer based toolkit, and it's telling me that this patient requires a review because he's on morphine and 2 or more issues in the last 1 month. It's also saying that this patient's eligible for structured medication review. If he was eligible for any blood tests, then you would have seen them here on the same window as well. Now in terms of showing you other aspects of the same template, it can help you to do reviews in terms of structured medication review if you're doing it as a part of PCN pharmacist. If you are a healthcare assistant or nurse and the patient presents to you asking for blood tests for monitoring, once you've run safety check, it will tell you which blood tests they require. So in this case, when I ran the search, this patient does not require any blood tests currently, so you can reassure them that the tests are not required. This is one way of managing your workload as well and not doing unnecessary tests. Now on top of this tab, you can see the polypharmacy tab. So if I click on that, it opens up a further page, and there are inbuilt resources on this. So if you've got a learning disability patient, you can click on Stomp tab, and this is again for stopping over medication for people with learning disability, and it allows you to then do reviews for that cohort of patients. Now going back to this page on polypharmacy review, there are resources which are highlighted in these blue click buttons, so you can click on them. So for example, if I want to know what's the polypharmacy guidance available, I can click on this tab and it'll open up the Scottish guidelines on polypharmacy. Now I don't know if you have visited this, but it's got lots of resources, particularly a toolkit for healthcare professionals, and that includes the 7-step process for medication review. So going back to the tab again, there are stop-start toolkits which were developed from Viral CCG. There is a resource here for anticholinergic burden calculator. So overall, you've got all the resources compiled in one place. If you have patients who require mental capacity assessment, you can use this to record the review when you're discussing it with nurses or any representative on their behalf. So in terms of the identification of patients, if they require any blood tests, any physical observation monitoring, or if there's any safety concerns with the medication they're on, just by running safety check on this tab, you can identify what actions are required. This will allow you to safely prescribe medication for your patients and also prevent any drug-related misadventures which can affect their quality of life or lead to hospital admissions. So thank you for watching.